What's really interesting is I've been, a medical director of some units at hospitals, psychiatric units, and uh, uh, alcohol addiction unit as a director of an addiction unit and child psychiatry unit, and got subspecialty in child psychiatry, but so I've seen a lot of depression through my lifetime, and then know how I treated it before, as I have had this experience 6 years ago in getting into anti-aging medicine and through my hypertension and diabetes, and curiosity and about hormones and everything else, that I learned to look at depression a whole lot differently when people come into my psychiatric office, for example, and somebody said, well, they say I'm depressed, but I'm just tired. I just feel fatigue, or the big complaint is anxiety. So many people say, I just feel anxiety all the time and I can't sleep at night. And frequently that's tied into worrying about what's happening the next day, to stress. So it gets to be a vicious cycle. And I've taken the stigma off where a lot of people get upset is that they don't want to go to their other doctors, or some people want to go and just get a pill, antidepressant or something, and let it work, or a Xanax or something for anxiety, something to take away the anxiety instead of go to the root cause, because anxiety is a symptom, and I think anxiety a lot of times is a symptom because we haven't been able to handle our stresses very well. We haven't been able to take care of ourselves. We don't eat correctly. We don't sleep right. We don't take vacations. We don't treat our spouses right. We, again, abuse our bodies with bad foods and going through quick foods and not doing the things that we know we need to do. With our excuses, we don't have time. Well, I just don't have time. I don't have time to exercise. I've heard that so many times, I don't have time to cook. I don't have time to go shopping there. The bottom line is, I forgot I was reading, and some great philosopher said, time's like a coin, and we got one coin, and how we spend that coin is going to be very important. We can let others spend that coin for us and use that coin, or else we can use it. So we only have so much time, and a lot of times we give it to everybody else, and as a result, then we end up shortchanging ourselves, and we become sick and ill, a bad husband, a bad spouse, a bad father, a poor worker, low energy, loss of interest in things, developing arthritis. I hadn't mentioned that, but arthritis is an inflammatory disease, and how much our supplements help arthritis, and I might mention that, help arthritis. It helps the high cholesterol. It helps with chronic pain. It helps with cleaning up the liver and diabetes. So a lot of the things in the supplements that I've learned, and as I find a good one, then I kind of learn to keep it and use it and tell people where they are and how to get them. But those things can really help our body function so much better. So I had taken Motrin for like 25 years, and then I later found out I was addicted to Motrin. And I was never taught I could be addicted to Motrin, but I learned it from a neurologist. They came up to talk in my clinic about addiction, and then I found out that caused a lot of my high blood pressure too. So Motrin was a major cause of high blood pressure, and or ibuprofen, and I'm not talking badly about that product. I'm just telling you that can be a side effect. And then it was a rebound addiction that I would take 400 milligrams, and in 4 more hours I had a lot of pain again, so I'd have to take another 400 milligrams. It'd go away in 15 minutes. And so I kept playing ball and softball, and I played softball till I was 59. And I played in the same way as basketball till 59. So it was about 6 years ago I finally retired. And it really hurts your ego when you have to retire from things you love, and softball and basketball. But I'm picking up golf again now, which I never had time to. I'm trying to make time and pick up some sports I can play at my age and my ability and my speed. I can't jump or dunk the ball anymore. It's just a fact of life. But back with the supplements are really great in helping. Blood pressure helps anxiety. Magnesium for anxiety really helps with anxiety. I have one I like with a little folic acid and B12 and vitamin C. It helps it all absorb and work together. Probably helps 70% of my people with anxiety. So people get frustrated with me when they want to just come in and get an Ativan or a Xanax, and I'm getting more and more of those people, and we try to screen them, but people become addicted to those drugs, and their life is terrible. They're in their 20s and 30s, and they're addicted to narcotics, and they're addicted to painkillers and benzodiazepines and Xanaxes and Valiums, or mostly Xanax and Ativans and Klonopins. But we don't have to live that way. And there are a lot of supplements that I can tell you help with anxiety. L-theanine's another one that's kind of made from green tea. It works very well. There's a plant called holy basil. I have one guy, he can never sleep at night for years and years, and it's the only thing that helps him is the holy basil. And it's just that one supplement, and it does something to his body. But he is the most nervous, anxious person I ever sit. When you sit and talk to him, he was so nervous. And so I never, holy basil, what is it? Is it a biblical thing or whatever? But it's you start reading then about these different plants that are in different countries, and that was its name, And Relora is another one that we have that helps people with anxiety and stress and to recover. And there's rhodiola that helps people from stress that you see with people that need, they call adaptogen herbs, like licorice. You've heard of licorice, but licorice is really good for the stomach, soothes the stomach. I have a lot of irritable bowel syndrome, and I hadn't even talked about that. We can do that next time. But a lot of irritable bowel, Crohn's, gastric reflux, I can really help by a lot of the supplements that I have. A lot of them that have, there's some colostrum powder that I have that has all the essential, non-essential amino acids, has IgG, IgA, IgE, it has insulin growth factor, and it's amazing how people get better. Their guts, or intestine, which is esophagus, stomach, intestines, get better with these and prevent them from having surgeries and having all these problems. But licorice is a great herb. Is one I get like German chocolate. Tastes like German chocolate candy. So all my people are happy to carry that around in their purse, and they start to get an upset stomach or pain or cramping, they can take that licorice, just chew 1 or 2 tablets, and it helps 90% of the time. It helps people. So just learning things like that has been amazing for me, and it's great for me to share that knowledge and helping people.